Thomas Rivera is a 68-year-old retired accountant from Phoenix, Arizona. He has been taking metformin every single morning for 4 years to manage his type 2 diabetes. His blood sugar numbers look excellent on paper. His A1C is exactly where his doctor wants it to be. But Thomas cannot remember where he parked his car at the grocery store. He walks into a room and forgets why he went there. He struggles to recall the names of people he has known for decades. He tells his wife, "I think my mind is just going. This is what happens when you get old." His wife refuses to accept that answer. She insists on a neurological evaluation. And when the neurologist reviews Thomas's medication list, she does not order a brain scan first. She orders a vitamin B12 test. What she discovers shocks both of them. And what happens next is something every single person watching this needs to hear. I'm Dr. Alexandra Morales, and if you or someone you love takes metformin, gabapentin, or omeprazole, this video could genuinely change the way you think about your memory problems. Here is what I have come to believe after years of working with older adults. These 3 medications serve critical purposes. That is not in question. However, the way they affect cognition, memory, and mental clarity in adults over 60 is often dangerously under-discussed. Many cognitive changes experienced by older adults are dismissed as simply part of aging, when in reality, they may be the medications speaking. Today I am going to walk you through 5 specific memory and cognitive problems that are directly linked to these 3 medications. And I need you to stay with me through all 5 because number 2 is a side effect affecting millions of people that almost no doctor connects to gabapentin. And number 4 is a deficiency that can mimic early Alzheimer's disease, but it is completely reversible when caught early. If you take any of these medications, or if someone in your family does, subscribe to this channel right now, because what we discuss today could change the conversation you have at your very next doctor's appointment. Before we begin the list, I want to give you a framework, a way of thinking about everything that follows. I call it the cognitive dismissal trap, and it works like this. Pillar 1, your doctor prescribed your medication to solve a specific problem. Metformin controls blood sugar. Gabapentin manages nerve pain. Omeprazole reduces stomach acid. All of these are legitimate medical interventions. However, what most people do not realize is that each of these medications has well-documented effects on brain function, nutrient absorption, and cognitive processing that are rarely mentioned during the initial prescription conversation. Pillar 2. The cognitive changes you are experiencing may be directly caused by your medication, but because they develop gradually over months or years, they are attributed to normal aging rather than pharmaceutical side effects. Pillar 3. Controlled lab values on your medical chart do not automatically mean optimal outcomes for your brain. Your A1C might be perfect, your pain might be managed, your reflux might be gone, but if your memory, your focus, and your mental clarity are quietly deteriorating, that is not successful treatment. That is a trade-off you never agreed to. That is the cognitive dismissal trap. Your primary condition is controlled, so everyone assumes the medication is working, and no one asks whether your brain is paying the price. Keep this framework in mind as we go through every single item on this list. Eleanor Castillo is 72 years old, a retired nurse from Austin, Texas. She has been taking metformin twice daily for 6 years. Her diabetes is well managed. Her fasting glucose is consistently in the normal range. But Eleanor has been struggling with brain fog, memory lapses, and a creeping sense that her mind is not as sharp as it used to be. She brought it up to her doctor twice. Both times the answer was the same. You're over 70. This is normal. Stay mentally active and keep doing crossword puzzles. Eleanor trusted that answer. She bought puzzle books. She joined a book club. She tried harder to remember things. But the fog only deepened. What her doctor never checked was her vitamin B12 level. This is not rare. This is shockingly common. A study published in the Archives of Internal Medicine found that long-term metformin use is associated with a significant reduction in vitamin B12 levels in up to 30% of patients. Another analysis in the Journal of Clinical Endocrinology and Metabolism confirmed that metformin interferes with B12 absorption in the small intestine by altering calcium-dependent membrane function. Here is how the mechanism works. Vitamin B12 is essential for the production of myelin, the protective coating around nerve fibers in your brain. It is also critical for the synthesis of neurotransmitters that regulate mood, memory, and cognitive processing. When your B12 levels drop, your brain cannot function at full capacity. You experience memory problems, difficulty concentrating, mental fatigue, and in severe cases, symptoms that can mimic dementia. The terrifying part is that B12 deficiency develops slowly. It does not announce itself. It creeps in over years, masked by the assumption that cognitive decline is simply an inevitable part of growing older. If you have been on metformin for more than 2 years and you are experiencing memory problems, ask your doctor for a B12 test. Not at your next annual physical, at your next appointment. And if your B12 is low or even low normal, supplementation can reverse the cognitive symptoms in many cases. If you are taking metformin and you have never had your B12 checked, type never in the comments right now. I want to see how many of you are in this exact situation. But metformin is not the only medication quietly affecting your brain. If you are taking gabapentin, what comes next may sound painfully familiar. Raymond Parker is 70 years old, a retired postal worker from Durham, North Carolina. He was prescribed gabapentin for chronic nerve pain in his lower back. The pain improved. The medication worked exactly as intended. But within 3 months, Raymond noticed something disturbing. He could not follow conversations the way he used to. He would lose his train of thought mid-sentence. He felt mentally sluggish, as though his brain was moving through thick syrup. He mentioned it to his doctor. The response? That is just part of getting older, Raymond. Your pain is better. That is what matters. Raymond accepted that answer for nearly a year. And during that year, he stopped going to his weekly card game because he could not keep track of the plays. He stopped driving at night because he did not trust his reaction time. He withdrew from activities he loved because he no longer felt mentally present. This is not a rare side effect. This is one of the most commonly reported cognitive effects of gabapentin, and it is severely under-discussed. Data from the FDA's Adverse Event Reporting System shows thousands of reports linking gabapentin to confusion, memory impairment, and difficulty concentrating, particularly in adults over 65. The mechanism behind this is straightforward but significant. Gabapentin works by calming overactive nerve signals in the brain. It binds to calcium channels and reduces excitatory neurotransmitter release. This is exactly what makes it effective for nerve pain and seizures. But that same mechanism also slows down cognitive processing. It dampens mental clarity. It creates what patients consistently describe as brain fog. In older adults whose brain function is already experiencing natural age-related changes, this effect can be profound. The brain fog is not imaginary. It is not laziness. It is a direct pharmacological effect of the medication. If you are experiencing cognitive dulling, memory problems, or difficulty concentrating while taking gabapentin, do not accept "it's just age" as the final answer. Ask your doctor whether a lower dose might be effective, whether an alternative medication exists, or whether the pain you are treating still justifies the cognitive cost you are paying. Type brain fog in the comments if you have experienced this while taking gabapentin. Your story could help someone else recognize what is happening to them. But there is one medication on this list that affects memory in a way that almost no one expects. And it is sitting in millions of medicine cabinets right now. Patricia Coleman is 69 years old, a retired office manager from Seattle, Washington. She has been taking omeprazole every morning for 5 years to manage chronic acid reflux. Her heartburn is completely controlled. She has had no digestive complaints. But Patricia has been struggling with memory lapses, difficulty concentrating, and unexplained anxiety that she never experienced before. Her doctor ran standard blood work. Everything came back normal. She was told her symptoms were likely related to stress and aging. What was never checked was her magnesium level. This is a gap in care that affects millions of patients. Research published in JAMA found that long-term use of proton pump inhibitors like omeprazole significantly increases the risk of magnesium deficiency. The longer you take the medication, the greater the risk becomes. Here is the mechanism. Proton pump inhibitors reduce stomach acid. Stomach acid is necessary for the absorption of several critical nutrients, including magnesium. When your stomach acid is chronically suppressed, your body cannot absorb magnesium efficiently from the food you eat. Over months and years, your magnesium levels quietly decline. Magnesium is essential for more than 300 biochemical reactions in your body, including those that regulate nerve function, neurotransmitter activity, and brain cell communication. Low magnesium has been directly linked to memory problems, difficulty concentrating, brain fog, anxiety, and even increased risk of dementia. The Journal of Alzheimer's Disease published findings showing that magnesium deficiency is significantly more common in individuals with cognitive impairment than in those with normal cognitive function. If you have been on omeprazole or any proton pump inhibitor for more than 1 year, request a magnesium level test. And if your magnesium is low, supplementation under medical supervision can restore cognitive function in many cases. If you have been taking omeprazole or another PPI for more than a year and have never had your magnesium checked, type PPI in the comments. I think you will be surprised how common this is. Now here is the one that scares me most, because it looks exactly like Alzheimer's disease, but it is not. I am not going to share a single patient story for this one, because the medical literature tells a story that is far more concerning than any individual case. When vitamin B12 deficiency from metformin or magnesium deficiency from omeprazole becomes severe and prolonged, the cognitive symptoms can become profound. Patients develop what clinicians call pseudo-dementia, cognitive impairment that mimics Alzheimer's disease, but is actually caused by a treatable nutritional deficiency. A case series published in the American Journal of Psychiatry documented multiple patients who were diagnosed with dementia, placed on dementia medications, and even moved into memory care facilities, only to have their cognitive function fully restored once someone finally tested their B12 and magnesium levels and corrected the deficiencies. These were not cases of early dementia. These were cases of medication-induced nutrient depletion that no one thought to investigate. Here is what makes this so urgent. The longer a deficiency persists, the greater the risk of permanent nerve damage. Vitamin B12 deficiency that goes untreated for years can cause irreversible neurological harm. Magnesium deficiency has been linked to structural changes in the brain. Early detection is everything. If you are on metformin, gabapentin, or omeprazole and you are experiencing memory problems, you need to rule out nutrient deficiency before you accept a dementia diagnosis. You need a B12 level, a magnesium level, and a comprehensive metabolic panel. These are simple, inexpensive tests that could change your entire trajectory. If someone you love has been diagnosed with dementia while taking any of these medications, and no one ever checked their B12 or magnesium, type check in the comments. This is happening far more often than it should. Sarah Lynn is 74 years old, a retired librarian from Portland, Oregon. She takes metformin for diabetes, gabapentin for neuropathy, and omeprazole for reflux. 3 medications, 3 different doctors. No one ever sat down and asked whether these medications, taken together, might be compounding each other's cognitive effects. Sarah's memory problems were not caused by one medication. They were caused by the cumulative effect of all 3. Here is the reality that most patients do not understand. Each of these medications depletes a different critical nutrient or affects a different aspect of brain function. When you take them together, the effects multiply. Metformin depletes B12. Omeprazole depletes magnesium. Gabapentin slows cognitive processing. Together, they create a perfect storm for memory problems, brain fog, and cognitive decline that is blamed on aging when it is actually iatrogenic, meaning caused by medical treatment. And here is what concerns me most. In most healthcare systems, no single provider is monitoring the big picture. Your endocrinologist manages your diabetes. Your neurologist manages your pain. Your gastroenterologist manages your reflux. But no one is looking at all three medications together and asking what they are doing to your brain. You have to be the one to connect those dots. You have to bring your full medication list to every appointment and ask the question that should be asked, but often is not. Could any of these medications be affecting my memory or cognitive function? If your doctor dismisses that question, find a doctor who will not. If you are taking metformin, gabapentin, or omeprazole and you are experiencing memory problems, here is exactly what I want you to do. First, request a vitamin B12 level and a magnesium level at your next appointment. Do not wait for your annual physical. Do not accept, "We will check it next time." Ask for it now. Second, bring your full medication list to every doctor you see and ask whether any of your medications could be contributing to cognitive symptoms. Make them answer that question specifically. Third, do not accept "it is just aging" as the final explanation for memory problems. Aging does change the brain, but it does not explain everything. And when symptoms develop or worsen after starting a medication, that timing matters. Fourth, if you have been diagnosed with dementia or mild cognitive impairment while taking any of these medications, request that your B12, magnesium, and thyroid function be thoroughly evaluated before accepting that diagnosis as permanent. And fifth, never stop a medication without consulting your doctor. These medications serve real purposes, but the conversation about whether the benefit still outweighs the cost needs to happen openly and honestly. Let me come back to Thomas Rivera, the man from our opening who thought his mind was going. His neurologist did not put him on dementia medication. She prescribed vitamin B12 injections and adjusted his metformin dose. Within 6 weeks, the fog began to lift. Within 3 months, his memory was sharper than it had been in years. He told his wife, "I feel like I got my mind back." Thomas's blood sugar is still well controlled, but now the treatment and his quality of life finally match. Here is what I want you to carry with you. A medication should help you live better, not just manage a lab value. If your diabetes is controlled, your pain is managed, and your reflux is gone, but your memory, your clarity, and your sense of self are quietly disappearing, that is not successful treatment. That is a trade-off you never agreed to, and you have every right to question it. Your brain matters. Your memory matters. And you deserve a doctor who treats both with the same level of urgency. If you are on any of these medications, I want to hear your story. What are you taking? Have you experienced memory problems? Has anyone ever checked your B12 or magnesium? Tell me in the comments. Your experience could help someone watching this right now who is going through the exact same thing. And if this video made you think differently about your treatment, share it with someone you love. Subscribe so you do not miss what is coming next. I'm Dr. Alexandra Morales, and I'll see you in the next one.